but you can catch this also, a replay of it on YouTube. Usually when we do a calm care spotlight, some handouts come out of it. And one of the things in Caregiving community is that we have a lot of free, cost handouts that are available at no cost in our library, where we also have coursing and other stuff. But the handouts for these calm care episodes usually, if we feel like we need to generate a handout from this, which I feel like we will have to,
Yeah,
then we will
I
put it in
do.
the community, and it will be free. The point of Care Caribbean largely is to give a lot of us access to this information, not to charge, the living daylights out of you. There are some things that you will have that have a cost, but most of the handouts in there are free, and I would encourage everybody to use them, share them, and access them. I'm not really trying to gatekeep anything. So please feel free to do that. Okay. So let me say a couple of things and introduce who I'm with. I'm really, really thrilled to have Dr. Melissa Walcott-Pusey with me. She is my very, very good friend and a fellow physiotherapist, and just an all-around impressive person. I've known Melissa forever. She is a physiotherapist, a doctor of physical therapy, and the owner of Total Therapy Limited in Barbados, right? Where hopefully I'll get this year. Let us pray. So therapy is a physiotherapy practice, but it also retails physiotherapy products. And she also, I know you used to, I think you still do host a massage therapist as well.
We have a massage therapist and we have other programs cater towards the elderly. So
Yes.
yeah,
And
wellness.
Melissa, like me, loves neurological physical therapy. I'm not a big orthopedic physio. I think Melissa
Yeah.
does everything. I've kind of moved away from doing orthopedics. I do neurological stuff. And of course, I'm also, obviously, I have a master's in dementia and do a lot of work in dementia care. So I think, and people can find out a lot about me. I have a video on the YouTube channel. So if you're really curious, you can find that there. Melissa, is there anything I missed about you? Is there anything that you want to add or
No,
flesh
not really. I'm just thankful for inviting me, Deborah.
out? So
And I'm looking forward to this discussion because, caregivers really, really do a lot and they need as much support as they can get.
yes,
So I'm looking forward to discussing these topics with you this evening.
yes, because we see a lot of this also, as so in dementia care for sure, but we see a lot of this in physiotherapy. And one of the things
Hmm.
that I say all the time is caregiving, it is full of repeated tasks, right? Like helping somebody to move, turning them in bed, managing their medication, assisting with their toileting and their hygiene, keeping track of supplies,
Hmm.
it's a lot of tasks that are repetitive. But it is also very stressful because most of us, if not all of us, are not full-time caregivers. Like we haven't quit our job and we're staying home with the person. Some of us even are far away from the person, as Grace and I know is. So you want to be kind of getting towards organization. One of the big things we talk about a lot in Care Caribbean, and one of the things that I assist people to do is care planning, because
Hmm.
everything is easier if you have a plan for it. We might not always stick to the plan, but there's some things that are predictable in caregiving. And so where the things are predictable, we know, for example, as I've said, we have repetitive tasks. We want to make sure that we have systems and tools to make those things easier, because where we're reinventing the wheel every time, it's likely to contribute to caregiver burnout, which of course is a
Hmm.
major concern for all of us, certainly physiotherapists who spend a lot of time with you, certainly for us in dementia care, because the evidence certainly in dementia care is that where the caregiver deteriorates, the care of the person deteriorates as well.
Deteriorate.
So
Yeah.
we are, and so not only do you suffer, but your ability to help the other person in the equation who really is vulnerable also suffers. A statistic I quote a lot too is 40% of all caregivers die before the person that they're taking care
100%.
of. So
Yep.
one of the ways in which we can promote efficiency, and cut down on the wear and tear on the caregivers is by looking at things like, gadgets and tools, right? It's, and when we say that, it's, I come across a lot of this, what I call physio junk, where the caregiver sees the physio using something, and they're like, oh, can I buy it?
Oh,
Or they buy this. you, they buy everything, and when you go there, you're waiting through all of this stuff, and you're like, oh my Lord, because what it represents in money and also in time. And the question also is, what we have to think about is, are we matching tool to person? And also, are we spending our money wisely? Because some things are worth the money, some things are not, right? And some things are unsafe if they're used
incorrectly.
Right. So we do need to consider these things. And we're here to kind of put you on game tonight about, as physios as well, about, when we're choosing things and so on, how do we do that? Dr. Nema, you have a question? I see your hand raised. Dr. Muid, sorry. Can you unmute? Your mic is still muted.
I'm sorry. I just wanted to say that I had a standing meeting that the last class is today at 8. So I will not be able to stay on. And so I just wanted to let you know I'm gonna segue off maybe 10 after or so. Okay. But thank you so very, very much.
Thank you for letting us know. We're hoping to be here for just an hour. I try to keep these things short because most carers, even if they're watching it in retrospective, they really don't have more than an hour to spend with us, if that. So we try not to do. The last one I did ended up being like almost 2 hours, which was, fantastic. Lots of information because we're talking about dementia activities. But we're going to try and keep it tight tonight, right? So we're going to have a little chat now really quickly about why it is that the right tools matter, right? So we're going to look at a lot of things tonight, walking aids, transfer belts, incontinence pads, pressure care, comfort tools. Melissa, you can say restraint mitts, mitts, organizers, a whole heap of things, right?
Yeah.
We're going to look at as quickly as we can. And before we look at anything, we have to talk about just why it is. I've said it already, but I'm just going to repeat it in another way, which is understanding why we want to have the right tool for the person that we're dealing with. And that is because, caregiving just gets much harder if you're trying to do everything manually, if you're doing things without systems, and if you're doing things without the right supports, right? Even myself as a physio, Melissa has way more years on it than me. I'm 25, I think 25 or 26 years. Melissa is more than me. There's some things I'm not flipping anybody in bed without tools and stuff like that. It's
definitely not.
The level of repetition with which I have to do certain tasks, we have to make sure that we're equipped for that, because you have to think of the fact that you're preserving yourself and your well-being. A lot of I don't know where last I've been, and some others told me about their back. And a lot of that back thing is because one is technique, but and the physios, usually when I'm there, I try to kind of help them with technique, because a lot of us are just doing some ridiculous things to turn. But two is also tools. If you have the right tools, these repetitive tasks, they become much, much easier. Melissa, you want to add anything to that?
Yeah, well, many of the caregivers that we know, they do get injured, not because they're being careless, but only because they're doing things, without any assistance, without any tools. And as you know, it's better for them to be able to learn how to use these tools correctly, take the pressure off of their bodies, because you're going to be doing it over and over again, as Deborah said. So let us find a way, or let us help you to be able to do these tasks more efficiently.
Yes. And also we're distressing ourselves, and we might also be distressing the person we're caring for. And this is something we talk about a lot, because we are trying to introduce the idea of patient-centered care. So while, we're caregivers and we believe that we have X amount of time, or we believe things should be done in a certain way, we still have to factor in the person that we are taking care of. Are we making this experience difficult and unpleasant for them? Which is going to, especially with our dementias and some of our older people as well, they're going to start to avoid the task, resist the task, not want to do the
Seem as
task
being difficult. Yes.
and give
Mm-hmm.
you a hard time, and then you're gonna start to dread having to do the task because you know you're gonna have to
Mm-hmm.
struggle with the person. So in having ease and also making it more comfortable for the person that we have to take care of, I think that goes a long way, because a lot of the time we are talking to caregivers, but you do have to remember that you are a caregiver because you are taking care of
Of somebody
someone,
else.
and
Yeah.
that person still requires dignity. They still would like to, as I said, not dread tasks and not want to push you off when you come to bathe them or whatever else.
Mm-hmm.
But a lot of the time, some of the resistance we have to things is really coming from the way that we approach it. And that can
Approach
be
it.
hard to hear as a caregiver as well. I know it, but it will make your life easier if we tell you all of these things, so that you can kind of think on these things. Good tools do not replace care.
That's
So
right.
I think that's something that we have to we have to say, so that everyone understands it. Tools support care, right? But care is covers the term care covers a lot of ground, and it's ground that has to do with many things: the environment, the people in the environment, what's going on with that specific person in terms of comfort, and or distress, or illness, are they incubating something, and so on. So even if we have really great tools, we still have to bring to it the qualities that I think all good care is about, which is compassion, the ability to observe, to put yourself in the other person's shoes, to catch things, to nip things in the bud. So where we
Mm-hmm.
see things developing, so great observational skills. And as I said before, just that patient-centered approach, the ability to sort of put yourself in the person's shoes, so that you can
Right.
understand, even when you might be a bit frustrated, you can kind of try to understand where we're coming from. Okay.
Yeah.
Um.
Yeah.
So
Yeah. Yeah.
Melissa, let's talk
Right.
about
I was
time saving.
saying,
Go
yeah,
ahead.
when we were saying time saving, and when that refers to time saving, we mean more than just minutes. So we're also talking about things like having to repeat things less searching and trying to find things because everything is in an ordered environment, less confusion, and definitely less cleanup. And most importantly, less strain and mental fatigue on you, the caregiver.
Yes.
Right? Mm-hmm.
Exactly. So sometimes, a tool that saves you time can also save you back. They can do multiple things. It may reduce how
Things
often,
together.
yeah, and it can, a tool may reduce how often you change the sheets, which also will
Mm-hmm.
reduce how often the patient has to be disturbed, right?
Right.
And it may, all of the goal of all of this is to reduce errors, of course, and to reduce stress in the home,
Mm-hmm.
both for the
Mm-hmm.
person, and both for the person being cared for and the caregiver. Yeah.
Right. Yeah.
Because we understand that every caregiver that I've ever spoken to is already stretched. We recognize you're working.
Mm-hmm.
Sometimes you're caring for the person overnight, and the nurse comes in the morning.
Morning.
Sometimes
Mm-hmm.
you're sharing with family members, you're sharing the care. And some of us, although I don't recommend it, are doing everything almost by themselves, you know.
Yes.
So
Yeah.
we want to sort of reduce the guesswork. And we want to also make sure that you kind of, as I said, we want to put you on game, make sure that you sort of understand what we're talking about, and how to make certain choices. You should see a little set
Yeah. There
of,
we go.
you
Yeah.
should see a set of slides join. And the reason
Yeah.
for that is really because we want to, there's some things that as we're talking, we might want you to, you can also probably look at
Um.
this. So let's get started, shall we, with walking aids, Melissa?
Yes. Yeah.
I'm
We can
going to
go
leave
straight into it.
that.
Oh, thank you. I feel so loved. Yeah, walking aids are a big part of physiotherapy. And very often you'd be surprised sometimes people come into the department or you see somebody on the road and you realize they're not using these walking aids correctly. Um, they are sold here, I'm sure in Jamaica as well. You can get most walking aids in the pharmacy. You'll see a walker, a cane, a walker, but there need to be very individualistic. Walking aids are to help someone walk, and because your grandfather used a cane doesn't mean that you should use a cane as well. Do you have the balance for the cane? Do you have, is it the right height for you? There's so many individual factors that we need to take into consideration. um, Even things like what side do you put the cane on? Right? Ideally, you should be putting it on the side that's not injured, so that you're
Right.
adding support, as opposed to having it on the injured side, which I see people do all the time. And then you switch it over, and they're like, "Oh, this is so easy." Yeah, it is once you're doing it correctly.
It is.
The choice of mobility aid really depends on the patient's balance, their amount of strength that they have, coordination. What is their prognosis and diagnosis? So you don't necessarily want to start somebody on something knowing that they're going to end up in the next 3 months on a pair of crutches, knowing that in the next 3 months they're going to need a rollator or a wheelchair. So we're going to take all these things in consideration. Not that we're going to rob anybody of their mobility, but we'll give you some advice, because each aid is expensive. We're not talking $5 here. We're talking some good money you have to put up with everything that you buy. So it's almost better to buy a rollator, which is you see in the picture here, that they can walk and sit on as they're going, so we can go for a walk in the park, or, do little activities, than it may be to buy a standard walker for somebody, especially considering that this person may not be able to ever walk again without an assisted device. So there are
Yeah.
little tricks and stuff that we can work into it. In terms of even the way the height of the device, there's a specific way, a specific height that uses less energy and puts less stress on your joints. Um, the best
And
person to measure
also
for
it
this.
decreases your fall risk. Sorry to interrupt you. But
Exactly,
yeah,
right? Yeah.
a lot of the
It
time we're
significantly
using,
decreases your fall risk.
yeah,
Yeah.
so a lot
So,
of the time
you
we're
know,
using things that when they're the wrong height and so on, or the inappropriate aid, we're thinking that we're making things easier, but actually they can increase fall risk.
the risk, yes,
Yeah.
significantly increased fall risk, not just increase, significantly increased fall risk. If you have got poor balance and you're using a set of crutches, the slightest thing on the floor, you're going to skid out and fall, right? So you really need to be very aware that this person's balance really needs more assistance than a pair of crutches or a single cane. And I mean, we sometimes even a single cane versus a quad cane. What size base of a quad cane are we looking at? So that the physios are really adept at being able to give you the idea, give you the advice, and just guide you into the best ones to buy. The other thing I find a lot with the walking aids is people don't take care of them. So things like the ferrules, I have a ferrule here showing you guys. The bottom of the
Yes.
ferrule is supposed to look like this. All right, can you see where it has a lot of rubber?
Yes, yes.
Very often you'll see silver. When you see silver, it's time to replace it,
Time to
because
change
that
it.
is the metal in the thing, and that's very slidey. So as soon as you walk on that, you have no grip on the floor. All right. So it's things
Exactly.
like that you need to be very conscious about, and know that and even with the wheels on the rollator, you'll see that you'll get little dents in the wheel as the rubber comes off of the wheel. The flat wheel is very difficult to push, right? We all know this from anybody who drives
Yes.
a car anywhere, right? So you
Mhm.
got to make sure you're putting air in them. You got to make sure you look at your specific one, check the brakes, and make sure the brakes are working properly. Because there's nothing worse than putting a patient to sit down on something thinking they're stable, and next thing the aid that you've put them to sit down on has tumbled down.
It's running
So,
away. Yeah.
it's
Mhm.
running away from them and you are running behind them. Or it's going around in a circle and they don't know why, and they're getting more confused. They become more combative, and they don't then, as you can imagine, no longer want to use this aid, right? And
Yes.
you're trying to convince them, okay, but it's safe now, and they're like, no, I'm not getting on that, because they
Yeah.
know from the last experience that this is not something safe. They don't want to be a part of it. So in order
You
to be
bring
able to
a good
keep
point
them
there. Mhm.
yeah,
No,
so in order to be able to keep them using the aids and keeping them as safe as possible, we need to make sure that they're in good working order,
yes. You
right?
raise a
You
good
know.
point there about safety, because I think also, and I know this is something you're big on as well.
Hmm.
I think a lot of the time when I say when non-physiotherapists, when you just say, okay, my aunt had a cane, let me see if this cane is gonna work for this person, or
Whoever. Mm-hmm.
right. We don't, and then, we'll get called because the person is not walking or has refused to walk and so on. A lot of that really has to do with safety, how the person feels
Mm-hmm.
about it. So even if you've done, and relators can be really funny because I love relators for a certain type, and you will know, like a more mobile patient who has a lot of
Mm-hmm.
cognition on board so that they know how to and can remember
Wow.
how to apply the brakes. And of course,
Mm-hmm.
as you said, this is assuming that the relator, for example, is in good condition,
And
Um,
also has enough strength to squeeze the brakes, because those brakes are not
right.
easy to close.
Yes.
Yeah.
So all of those
Mm-hmm.
things are related. Of course, one thing we know, we have walkers with front wheels. We know we have walkers that have no wheels and so on. So the related is the higher end of the selection for
Mm-hmm.
closer to functional in the selection of walking aids. But I do think, as I said, we do need to remember that walking aids, unfortunately, they are freely available everywhere, which I think is about, sometimes people cannot afford to access care and so on. And so I think the pharmacies, and so their intention is good. But
It's very good, yes.
yeah, so but the unfortunate fact is walking aids really need to be assessed and prescribed properly. And
Yep.
where they are, and when they are, the sense of safety that is needed in addition to the function, because the safety, the person being able to feel that they can manage this walking in, that this is comfortable for them, that contributes to them either walking, as Melissa said,
Or
or
not.
avoiding the task or refusing to do the task.
Mm-hmm.
And so we are physiotherapists, not plugging us, but plugging us. Physiotherapists really are the best people to prescribe a walking aid. Even if you go for one
Yeah.
session, I understand about expense and so on. But even if you go for one session and you say, my aunt has been told that she needs a walking aid of some sort,
Aid.
would like you to assess her and prescribe the aid. It doesn't usually take us a million sessions to do that unless there's
No.
some other issue. So if aunt's balance, if aunt's or uncle's balance is so poor that needs management, because a lot
Mm-hmm.
of the time we're trying to prop someone up on a walking aid that their balance is really too poor, their
To
core,
use.
their
Mm-hmm.
coordination and so on, when it's not adequate really for, that needs management in itself. And where
Mm-hmm. Mm-hmm.
we just sort of slap on the walking aid, it's not going, walking aids, they don't really solve if there's another problem, and they might not, if they're not appropriately prescribed, they're
Prescribed.
not at the right height, they're not the right type. No one knows when to use it. It is they can make things worse, and they are not a prescriptive for avoiding fall risk. I think,
Right.
people like to say, oh, they're unsteady, get them a cane. They fell, let's get them a walker. Or they nearly fell, so
Yeah.
let's get them a walker. But if there's something underlying, right, that
Mm-hmm.
has not been addressed, the walker in and of itself has not. I've come to a lot of hip surgeries. I don't do a lot of orthopedics
Right.
anymore unless there's also neurological overlay. But I've come to a lot of hip surgeries and so on of people who had walking aids. It's not that they didn't have the
Yep.
walking, but because the
Yeah.
issues weren't addressed,
Mm-hmm.
they end up with falls, and
Yeah.
as I said, I get it, Jamaica, I'm sure Barbados too, we have this very strong sense of community. Your auntie had a walker, somebody had a
Just send it,
cane.
lend it to them. Yeah. Lend it to
Yes,
somebody else. But
get
as
that.
you said, right, it's very important to understand what the coordination and balance look like, and strength. So if your lower limb strength is not great, a walker is not going to help you walk,
No,
right? It's
you
just
have
not going to
to,
help you walk.
sometimes
You
you
really
have
have to look
to,
at the whole person, the whole issue. And it's not about, therapists just wanting to make money off of you, but you'll see things that you might not necessarily see. And we can give you a home exercise program. You find things that you can do as well to be able to keep the person mobile.
yeah.
And the more mobile a person is, the easier it is to be their caregiver.
Yes.
Yeah.
And that is
Yeah.
something, that's something we need to remember as well. So you want to promote mobility in the right way. And as I said, don't be penny wise. I always say penny wise and pound foolish. Do not say,
Foolish.
I'm not gonna spend for the physio visit, or I'm not gonna spend for the, the consult for the walking in, and end up spending for a hospital admission and a hip replacement
And a hip replacement. Yeah.
or a wrist
Yeah.
fracture or something like that.
Mm-hmm.
In those ways, that also is an efficiency, being preventative in our approach, instead of saying, oh, what's the worst that can happen? Trust us, there's a reason that we are a profession. The worst can happen, and the worst is usually really expensive. So as I said, always weigh up those things as a caregiver. Say, okay, but do I, weigh it up against what happens if the person does fall. If they fall and have a fracture of the hip, what we know as medical professionals is that there is a strong relationship between hip fracture in older people and death.
Yeah.
So falls, which is, that's another passion. I know I'll talk about that on another live, not this one. Fall prevention is a big thing for you as a caregiver. You don't want to, have the person tumbling and tumbling and tumbling. If the person is falling, it's usually one of the first signs of cognitive impairment. And it also, as I said, it also can have a very expensive end. And tragic end. So we really want to put a lot of effort into getting in front of that, as averse to, trying to sort of, avoid doing a lot of things, and then, you end up with a hospitalization on your hands. Speaking of falls and hospitalizations, let's move on, Mel, to our transfer belts.
Yeah. These are amazing tools. Amazing tools, and I don't know why people fight them so much. But from a safety perspective, it really assists you in having the patient in a good grip for when you're about to move them, whether it be from the bed, and people always say, well, you could just use the clothing, right? But the problem with clothing is that clothing shifts, it moves, it might not be fitting properly. I've seen people move patients and the buttons fly off, and you're like, oh, you didn't think of that, did you?
No, and also concern to me, and I think to you, I know to you, because we spent, we spoke with all of this. This is, preaching to the converted. I never get tired of saying to my caregivers, pulling people by their hands, pulling people by their limbs. Again, you're going to end up with some costs on your hand. I cannot tell you how many people I've gone to who are like, my shoulder is always hurting me. Oh, she's always talking about her shoulder, talking about her hip. Yes, because if you're pulling her by the hip, or you're pulling her, you have your arm under her arm
constantly,
and all of that, it is going to eventually cause injury and pain and discomfort for the person. So learning to transfer properly, which is, there's a wealth of resource on. I frequently get teaching transfers, and I'm like, I don't think it's necessary, because there are really some excellent videos coming out of hospital systems that are archived on YouTube that anyone can look at, anyone can access for free, and look at, how do I actually do transfers well. Transfers, we are taught transfers as physiotherapists. I believe the nurses are taught it as well. And we're taught transfers because when we transfer, we want to protect our musculoskeletal, so we don't want to injure ourselves. And we also do not want to injure the patient. And things like pulling by the limbs is a real, or, using the head or the
definite no. Yeah.
It really does cause a lot of problems. Really quickly, going completely off script here, I just want to point out, because this is a thing of man. So a lot of us it's on my left, you have the simple standard gait belts, right? Which I personally, I will just say this as a physio, I don't really suggest most of us who are not trained as physiotherapists use this. We are judges of who this belt is appropriate for, because this belt requires a certain level of functionality on the part of the patient, and where they don't have it, what is going to happen to you is the patient is going to slip through the belt. Let me save it a suspense. What's going to happen is the patient is going to go zoops and drop right through the belt onto the floor. I have a harness here because this is a nice idea for
Right.
people who
Alternate.
are sitting up. You know, you can
Mm-hmm.
put the belt, you can put the transfer harness under them, and you can help to pull them upright without using like their neck or any other thing.
Mm-hmm.
My
Yeah.
favorite thing is on this page, and this is a transfer
Ah, that's
belt,
it.
a gate and
Mm-hmm.
transfer belt that has
Yeah.
leg straps. You know, this
Mm-hmm.
brand is VVIVE, Vive. But there are other ones, I'm sure. I use this
Yes.
particular one myself in my own practice. And this one is something that it's a very safe tool for a caregiver who, you know, doesn't have, again, this has a lot of videos on YouTube. You can look at how to use it. It has a lot
Mm-hmm.
of grips. I think it has about 7 grips, you know, so
Different
that you,
places to hold on to.
right.
Yeah.
And the video that is here on YouTube that I've stuck in here, that shows you how to effectively use it to transfer, right?
Mm-hmm.
So even though we're talking about, because, you know, as I said, the first gate belt that I showed you, I would say to you, that's probably, you know, if the patient is very, very functional,
Mm-hmm.
then we
Mm-hmm.
we will use a belt like this. But if you're trying to lift someone or help someone really, more than mild assistance to get up, or to stand up, or to move, I would suggest that you use a gate and transfer belt that has
Transfer. Right.
leg straps, because if not, as Melissa mentioned, with the grabbing of the clothing and all of that stuff, it is, you know, things are gonna get very, very sticky. Couple
Yeah.
things I need to say about the transfer belts, and Melissa, feel free to jump in. Let's just remember with transfer belts that, like walkers, they're not a miracle. Okay,
Nope.
so
Not magic.
yeah. So try
Mm-hmm.
not to move people who, you know, are not safe to move. You know, it's not for dead weights, right? If
Right.
the person is having some blacking out episode or so on, I would
Not
not
for them.
recommend that is the time to transfer, and please use your judgments around it. And it does not make, if the transfer would be unsafe in other ways, please remember it will still be unsafe
Yeah.
with the
With the
transfer
belts.
belts. The
And
transfer
another
belts,
thing is,
go for
yeah,
it.
to make sure that you know that if this person needs more than one person to transfer them, because not everybody can be done single-handedly.
Yes.
And I think sometimes you feel you put on a belt and then I become superwoman and I can transfer anybody. But it's better to even do, use it with two persons so that you're quite safe and you're assured that this person is not going to have any issues. Don't be afraid to ask for help, and know that, as Deborah said, if the transfer is going to be unsafe, no matter what you use, it will be unsafe. Let's try a different method and another
Mm,
way of attaining that.
I agree.
You know?
So let's have
Hmm.
a look at our incontinence stuff, shall
Yeah.
we?
Yeah. Hmm.
So incontinence pads. So I love, and I've put it here on the far left. There's a
Hmm.
It's a fairly new development that I've seen, where we have the drawer sheets that have the
With the,
handles on it. I don't know why
yeah.
I didn't think of it before. I would be a
No,
millionaire
I'm
if I
telling you.
before, because it's a fantastic idea, because it really
Yeah.
helps you to use the incontinence pad,
Hmm.
because what they've done now is they've combined so if you had reusable underpads before, the ones that are fabric and have the padding, what they've done
Right.
is they've put like the canvassing on top, and then it's an incontinence pad as well, so a rewashable
Right.
pad that also has handles, so you can move them around on the bed. I think it's
Easier. Yeah.
a real piece of genius. And then you can also, using the handles on the opposite side, you can use them to pull the patient into a turn,
Right.
and
The
so on.
turning.
So, or to reposition them up or down the bed, as Melissa says, with the assistance that you need. Again,
Yeah.
having handles on the sheet is not going to turn you into superwoman.
Superwoman.
So
Hmm.
let's
It does
remember.
not. you
Yes.
know
So
the other
let's.
thing that I just want to jump in there, yeah, I love that draw sheet with the handles, but if you
All
cannot,
right.
and just you haven't gotten one yet and you need another help, just folding a simple sheet a couple of times and making it a long sheet under the patient. So the flat sheet, you fold it in three, you put it under the patient so it's hanging over the side of the belt. the bed that you can then flip and turn them with,
Little bit,
help to pull them up and down the sheet. So you would put the Inco pad on top of that, yes. So,
yes.
but at least you have
A
something
quick
else that
way
allows you
to
to
move the
move the
person. Yes.
patient, move them
Yes.
safely. It
That's
used to be
the
something
old
that you saw
time
all the
way.
time. It's a
No,
very
that's
old
the old
time way, but
time way.
it's still very, very effective,
It's
if especially if you can't.
important. It is important.
Yeah,
I'm thankful to you
you
for I
know,
use it a lot. Where you have
yeah,
patients who don't have affordability or don't have access to
right.
Amazon or so on.
Yeah,
I'm a big person as a physician. I know you are too, on using what you have on hand, right? And
yep,
an
yeah.
old flat sheet, if you fold it 3 times so that it's under the person's torso, under the bottom and under the shoulder blades and above their shoulder blades, you can get, if one person holds one end and the other, excellent point, Mel.
Yeah.
You can move them a lot more easily. I notice when I go, I'll ask the nurses if they're not familiar with draw sheets, and they'll say yes, but they don't nurse the person on a draw
With a
sheet.
draw sheet.
I
Yeah.
cannot tell you why that is,
I
but
can't figure it out either, but I'm always like, let's put a draw sheet in because then it's easier for me. And I know
yeah.
that when physio gets there, the patient is sitting up and they're getting off this bed and they're doing things. So let's
And
figure this out.
a sheet can also, so it can help you move up and down the bed, but it can also help to pull the person
Pull
into
you up.
upright. So
Yes. Yeah.
that's a great technique. I was taught that when I was in school, and it is a great technique.
Yeah. An
Lots of
amazing
caregivers,
one.
for some reason, I don't know, but as I said, it is worth mentioning as a tip and trick.
Mm-hmm.
Also, I think we should talk about, there's no real good way to say this, people. You have to look at the quality of your product when it comes to incontinence or
Yeah.
continence. If you want to know what I'm
Mm-hmm.
talking about, your diapers, because continence and incontinence might sound mysterious. We're talking about the things that you use so that the person, if they need to, pass urine or they need to pass feces and so on, that contain it. So diapers, incontinence pads, any kind of
Mm-hmm.
absorbent pad. You do want to have good quality diapers and so on. In Jamaica, I'm gonna say nobody has sponsored this, so what I'm talking about is just my experience as a physio and as someone who is a carer. In Jamaica, we are very lucky. We have Caramed that manufactures baby wipes and diapers
Right.
now. So a basic form of diaper, but the quality of those diapers is actually quite good, and the quality of the wipes is very good. And I would say to you, consider, because sometimes we're really tempted by the price, and I get that.
Mm-hmm.
You say, "Oh gosh, this is much cheaper than the other thing." The Lullaby brand in Jamaica is not that expensive. It's quite cheap because I said it's manufactured in Jamaica, so
Here.
more than
Mm-hmm.
competitive here. But I am going to say that it is a really good idea to look at the quality of the diapers and so on. One, because you don't want to be paying for skin issues and all of this,
Right.
the rash and all of the ointments or the this and all of that sort of stuff. And two, because the frequency with which you need to change things decreases if you have quality absorbent products. So, and
Mm-hmm.
quality does not always mean price, as I've just said. So I just want to be
Right.
clear. But it doesn't. Price Mart in Jamaica, for example, has because the other thing we have is size. A lot of us are
Mm-hmm.
putting this big patient on this tiny incontinence pad and stuff like that, which and it's thin and it tears and it's look at the size of your pad. Most
Mm-hmm.
companies make up to extra large. So if your patient is not, like a size small, then you want to be looking at the size of the pad as well. Using the wrong size incontinence pad, the wrong size incontinence products is going to cost you in GP visits because and in
Yeah.
changes, the frequency with which you need to change the diaper, the frequency with which you have to keep pulling out the incontinence pads and stuff because they're not good quality. You get 50 of them,
And they're
but
not holding.
you've used 20 of them in one day. Because the person is having diarrhea or something like that. These things happen. You use Ensure,
Mm-hmm.
you end up with diarrhea, and then you burn through all of the
Everything.
incontinence
But
products quickly. Go ahead.
The other thing is the wipes. They now have adult wipes. So instead
Yes.
of the tiny baby wipes that are like that size, the adult wipes are, really big. So
Bigger.
you're not
Yes.
having to worry about getting things, making a mess while you're wiping, because it covers your whole hand. And,
It's
it
important.
really changes the game. It's a game changer to be, and you use less, right? So you're using maybe 2 adult wipes, while with the baby wipes, you're using 6 to achieve the same
Ethics.
job.
Yeah.
Yeah,
The other thing I
so
should say is look for off-brand, and this is the last tip before we move on to pressure care. Look for off-brand products. Some people are insulted when I say this, but PriceMart in Jamaica sells padding. It's like it's really an incontinence pad, but it's branded for pets, right?
right.
It's a
Hmm.
huge pad. It's huge
Yes. Yeah, yeah.
incontinence pads. You've seen them, I'm sure, if you go in PriceMart. It's huge
Yes.
with a green backing. And they're like, oh,
Hmm.
it's for your dog to go potty. That is an incontinence pad, but it's just off brand. It's being used for another purpose.
Another purpose. Yeah.
Yeah. So look also for, if you're caring, look also for products that might be branded differently and therefore are cheaper, because a
Hmm.
lot of my caregivers just tear up the dog box so that they're, you don't want the person to, to be like, are you using an animal product? And then they use the incontinence pads because they're much cheaper.
Yeah.
That's some.
Significantly cheaper.
Yeah,
Yeah.
so just tear up the box so nobody is looking at it and say, I've read the box of those pads, because some things that are for pets may have chemicals. So read the box.
Right.
But
Read it and
those
make
are
sure.
really
Yeah.
just off-brand, plain good old
Inco
incontinence
pad.
pads. And
Hmm.
they're large and they are very cheap. They're much cheaper
Hmm.
sometimes than the on-brand incontinence pads. So,
Hmm.
use
Hmm.
your, look, don't be surprised, don't be afraid to look at things that might look like what it is you want, but it's branded for something else. It's branded for pets, or it's branded for something outdoor use or whatever. And
Hmm.
you're like, actually, this looks like the same thing that, that
I've been
I need to
using.
use with
Yeah.
yeah. If that's the
Hmm.
case, knock yourself out, go for it. So we're
Hmm.
we're a little bit time crunch, so let's move on to pressure
Here.
items. Sorry, let me get on off of the
Incontinence. Yeah.
incontinence. So pressure items for those of us who are using wheelchairs, chairs, really anybody is sitting. I'll be honest, I'm sitting on a pressure cushion as we speak,
Hmm.
right? And I would tell you, if you sit quite a bit, whether you're ill or not, I would suggest
Makes
that you
sense.
get a pressure cushion. Otherwise, you are probably going to have some pretty bad lower back and bottom pain. And one of the things about these pressure managements is that they help to distribute the weight and so the
Hmm.
pressure through your bottom, through your spine itself. I'm again gonna say this is not a miracle product, so don't say, okay, I have a pressure sensation. Let me sit down now for longer than I normally would.
Yeah. For the
You will
whole
problem.
12 hours later.
Right. But if I would say, if your routine is sit for more than, I would say, even half an hour routine, and most of us
Mm.
are doing that, let alone the people we take care of who are often sitting through disability for very long periods of time. The pressure cushions are not an optional thing. They are
Mm-mm.
necessary. If you sit in a wheelchair for 20 minutes without one, everybody should try that. You'll see why you need a pressure cushion, because it is.
Yeah, and the wheelchairs are made for a cushion. And then you look at the seat sag. So clearly it's made for
You
something, a
know,
cushion,
it is
but
it
it's
is
very
ma-
difficult to convince people about that. But it
yeah,
really is made for a
it's,
pressure cushion.
it's awful. The
Mm.
pressure cushions we recommend are the combination ones, because you have these awful
Hmm.
little sponge ones in Jamaica. Please, guys, again, penny wise, pound foolish. You need a proper gel foam. I recommend the gel
Right,
foam hybrids. It
right.
means that I'll go back to the last picture. They have the gel in the middle, and then they have memory foam as well around and underneath.
Around it.
So
Hmm.
the gel usually, and a lot of the gel cushions are also cooling cushions, which,
Hmm.
yes, if you sit on your
In
bottom,
this heat.
amen.
Yeah.
So the gel foam hybrids, I would tell you again, This is, if you're using Amazon or so, this is a 20 buck product, $24. It's, you don't have to pay a lot of money
US.
for the gel cushions. Don't be afraid to look again at, once they have the criteria, right? Which is they have the gel and the foam, and it's the proper distribution in terms of the gels on top. The foam is on the outside
On
and
the bottom.
underneath.
Yeah.
You can, and your gel cushions, when you use them, if you buy a decent one, and as I said, you should be able to get a decent one for under 30 US, you should be able to use that for like a year. We need to remember with pressure products that, just like we talk about the ferrules and the cane and the walker, they wear. So after they perform, they will end up, you do need to replace them. I will tell people that every year, look at them and see how they're looking. If you have a light patient who is not sitting on it like from dawn to dusk, it might be less worn, but look at it. The other two pressure products, just skipping through, Mel, the positioning wedges and the heel protectors.
And I also like the ones for the bed as well, the mattresses. Either the airflow or the gel mattresses, because if you're lying for such long periods, you do need to protect those other joints, the shoulders, the hips, those bony prominences that get stuck, and you're leaning on those, especially around the ankles. So the heel protectors are amazing for that. There are a number of different ones. So just look at the product and know who you're buying for. So if you, as Deborah said, if you have a light patient, you might not necessarily need to get the heel protectors, or you may, because their bony prominences might be more out there than someone who has, very large, it has a good fat layer protecting them, from that. But still, even with that, you do need some level of protection if you're going to be on that joint for hours on end. And nothing replaces turning. Remember, we need a 2-hour regimen, which is difficult when you're doing it on your own, right? But at least this will give you a little bit of protection, that if they're sleeping at night, you don't just have to run and be like, okay, we need to deal with this now. It gives you a little bit more protection.
Yes. And also all of this chat about pressure. So the heel boots, the inflatable protectors, some are inflatable, some are just cushion.
Right.
The positioning wedges, which I think we're finally beginning to see more of them in Jamaica now. Positioning wedges, you can just use a good old-fashioned good pillow, a thick pillow. But a firm pillow. We have nice pillows here that are very firm, that's maintain their shape. Because for positioning, you cannot use a little funky pillows, but these are the pillows that they collapse in you wash them once and they collapse and they're flat. That is not sufficient for positioning and for pressure relief. And just sticking a man in the patient doesn't make it you want to use the right things. In Jamaica, we have a foam factory. I would recommend, if wherever anybody is watching this, if you have anyone who makes foam, a factory that makes foam that has an outlet, a lot of those will cut. So if you don't have the wherewithal to buy it on Amazon or whatever, you can look at the dimensions on Amazon, give it to the foam factories, and they will cut the wedges for you. In Jamaica, they'll cut it. As far as throughout the Caribbean, where you have because we are used to working with what we have. So throughout the Caribbean, where you have the foam factories and so on, you should consider asking them if they will cut the wedges for you. The dimensions, you can just search the dimensions on YouTube or Google and give them the dimensions and let them cut them for you. So you can.
And I would usually advise, though, with the foam, that you cover it. So even if they can't cover it there, just put a sheet over it or something, so that it's not abrasive to the patient's skin.
Definitely.
Annoying them.
Definitely. And as I said, again, the good pressure management, which doesn't always have to be expensive, again, is a big money saver, because where you get into developing pressure sores, that is a lot of management. And it is, again, it's a route for infection. Where we end up with pressure sores, we are more likely to shorten the person's life to the blood
lifespan,
because they're likely to succumb to sepsis, especially if they have, because it's very, the being on a bed and it, is, and the heat and all of the
Yeah, and
components.
they're not breathing well and
It,
everything else that goes along with it. Yeah.
yeah. So managing, so prevention of pressure, prevention of ulcers, prevention of the source is what we're after with the pressure management. And obviously once you have one, you need to manage it by using these pressure tools. But ideally, we also want you to don't wait until someone has a sore or has something like
Till it
that.
develops.
Us to be saying, okay, let's get in some pressure management. I think we're gonna run a little bit over time, but
That's so fine.
we're kind of wrapping up now. So this is another heel protector, which, as you can see, some of them are padded and some of them are inflatable, right? A lot of our nurses will say, oh, just put some water in a glove. It can work, but I find it to be a lot of adjustment and work. And again, we have to think about our burnout. Isn't it better to find a product that we can simply put on, check to make sure that really we're not strapping it in tight and leaving person in forever, but something that we can put on. It's not necessarily expensive, and it can just relieve the pressure in a consistent way. If the person turns or twists, the heel don't fall off.
Right, fall off of it. Yeah, fall off the glove.
You have to go and adjust the glove. If you don't have any other thing, for sure, use the glove with water, but really
use what you have.
Yeah, but really consider getting in. If the person is bedridden or spends a lot of time in bed, really consider getting the heel relief
Heel pads.
in addition to the mattresses, as Mel said, and definitely because they have these awful, the inflatable plastic ones, and then the patient is sliding all over the place on it, and it's so hot and stuff. And so do see, if you, again, if that's what's available to you. But I would really encourage you to look at, as we're talking about, like the things that are made of foam, memory foam for the mattressing, right?
Right.
Memory foam underlines those gel cushions, but memory foam for like a sitting cushion in and of itself is not usually
the best.
You want the combination of the gel and the
memory foam.
Yeah. Okay, so on to a big section here, medication tools.
Don't forget the mitts first. Yeah.
Before we get to, let's talk about the mitts, right?
Yes, let's talk about the mitts.
let me let you talk about the issues with mitts, right? So
sure. Especially if you have a patient or a loved one who is very agitated. So we're not thinking of mitts as just restraining for the sake of restraining, but you have someone who's agitated, they're scratching on their skin and causing themselves cuts and bruises. They're pulling out tubes, they're pulling off any dressings that are on, pulling out the incontinence tubes, anything like that. A set of protective mitts makes sense. There are many different types. These ones here that Deborah has up, they're just a round mitt, so there's nothing to say go into tiny hands. They're easy to put on. The straps come off easily in case of any issues. Both of these. Yeah. Some of them will include, the ones before included have had the entire hand on. Sometimes when it's really hot, like it is in the Caribbean, they are uncomfortable for patients that might make them a bit more agitated. While these ones here where your fingers are out, they're just really the wrist pulled away from the patient, and you can just tie them onto the bed, just to keep them from injuring themselves. Right.
And also, like with dementia, we have picking. A lot of patients will pick their skin until they bleed. We all know somebody who has yanked out their urinary catheter, as Mel said, or their NG tube.
NG tube. Yeah.
This particular set here, I really love because the mesh is cool. For those of us who need also to monitor, like we need to put a pulse oximeter on the finger or so on. The zip of the removal of it allows you to also do that. The zip allows you to fold back the top and put on,
so you can,
without having to, pull off the whole
take off the restraints.
Restrain the patient.
Yeah, these are a nice pair.
So this is a very, very nice pair, and it has a little thing for the middle finger, so it keeps the hand in place within.
So you can't move it. Yeah.
Glove. So That
Mm-hmm.
is, I would say, yes, you know what your patients are like, you know what the person you take care of is like. I would just not encourage anyone to restrain people, all the time.
Mm-mm.
And also to sometimes we can do other things. We can distract them. People sometimes are restless because they're uncomfortable. So do we need to look
Mm-hmm.
at adjusting them? Do we need to give them a painkiller? Do we just need to supervise them? Do we just need to keep an eye on them and say, okay, no, don't do that, and they'll stop. Is there something in the environment that's provoking them, that is causing that
Mm-hmm.
repetitive behavior? Can we give them something that they can squeeze using their hand, a noisy toy or a soft toy that they can ring?
Something, yeah.
I had an aunt who we gave her a carrot, a stuffed carrot toy, and she would just squeeze it and ring it and whatever. She had dementia, and it kept her from doing any other thing.
Picking.
Yeah,
Yeah.
she just played with the toy. So also
Mm-hmm.
consider other things. And as I said, I really want to discourage anyone from having someone, restrained all the time. There are
All the
times,
time.
especially with older people and people who have cognitive impairment, they don't understand what's going on. It's like a surgery has happened, or as I
Mm-hmm.
said, they're having a
A
urinary
tube.
catheter, or they're having any kind of tubing nose, or peg on the tummy, wherever.
Right.
You might have to use these things, and just make sure that you're doing it, and you're giving the person their dignity, and you're monitoring. Even though these gloves are padded and they are very safe, we just want to be very clear about
Yeah.
not abusing it. There are useful tools a lot of the time, and they can save you a lot of stress. You can't stay up 24 hours, and if
Yeah.
somebody is picking or trying to pull out something, you might have, these gloves can really give you
And
a lot of help sometimes
yeah.
when you need it. So I've
Yeah.
included here because it really, that can just take a lot of mental load off of you. You
Yeah.
might be able to actually sleep because you know
Yeah.
but
Yeah.
just make sure that you check on the person so that they're not cutting off their circulation or any other.
Right, right.
Always
And
monitor.
also know that if you realize you're using this day after day after day after day, start thinking, okay, is something else going on? This may
Yeah,
be a sign or time to take the person to to see their
the
doctor because
GP
something
or the
has changed.
specialist. Yes.
Right. And they might not be able to say to you, boy, but the specialist might be able to figure out, okay, something else is going on. So it might be that as well. So know that is if you realize that I haven't ever had to use them before. I know every night if I don't put them on, it may say
It's a
something else is going
problem.
on and require you
Yes.
to go and talk
Yep.
to the physician.
I agree with you.
Hmm.
Okay, moving on to the next thing. We need to look at medication management. That's a big, big thing.
Yeah,
For
this is a big one of my pet peeves.
Yeah.
Yeah,
And
yeah, it really
also,
is.
yeah, I have had patients who, with no exaggeration, have lost their lives because of the
Hmm.
poor administration of medication. One of
Hmm.
our colleagues, in fact, you will recall, Melissa, really ended up
Hmm.
having a massive stroke because she was not.
Because of it. Yeah,
So,
yeah,
we do
yeah.
need to make sure, aside from organizers, where we have people who are caregivers, and so we do need to make sure that we are having some oversight on that in terms of what
Hmm.
medications are being given, and double checking that they understand the times of day. And so, because some things we say take every
Right.
6 hours, not everybody is good with math. Lots of people mix things up as well. Pills can look alike and all of that sort of stuff.
Hmm. Hmm.
So we always want to suggest that you organize them, or by time of day, this pill organizer on the left with the different
Right.
colors, it's morning,
Is a time of
afternoon,
day. Yeah.
and then also, like, there's some pharmacies, Fontana in Jamaica, does it at no additional cost. They will organize all of your drugs into blister packs. So all you have
Right.
to do is, with time of day, so what is for morning, what is for afternoon, they'll
Yeah.
organize it into blister packs at no additional cost to you, so that you can just give the dose. The pharmacist has already organized
Put it
it,
apart. Yeah.
so you
Hmm.
just need to dose it. And you can ask at, obviously, I'm not everywhere in the Caribbean, I would imagine if we have it in Jamaica, you probably have it in
Yeah, we do.
near
A few
you.
countries. Yeah.
So
Yeah. You
you
just
can
have to ask, you know? And I
ask the
mean, to be quite honest
pharmacist.
with you,
Mhm.
as a caregiver, the pill organizer really does save you time because you
It
get have on
does.
either you do it on a Saturday once a week. You sit down there, you put out all the pills, and then you know if they've taken them. You don't have there's no guessing because it's there. And I mean, even for somebody who is visually impaired, if
Yes.
you only have a morning and an evening regimen, right? You can put it. You buy one that says morning and evening. There are some that, unfortunately, we don't have a slide with it, but morning is on the opens on the left side and evening opens on the
Yes.
right side, right? So
Yes.
it's very easy. And I mean, you have 7 days. So even if they open on Monday and take it on a Wednesday, when you look back and realize that there are five more filled containers, you
Doses.
know,
Yeah.
yeah, you know, okay, yes, they've taken these pills, as
Yeah.
opposed to guessing or having to get up every day and put out pills. That's time that you could be doing other things. And
Yeah.
you know, this is all about making sure that you have time, even just for yourself as a caregiver, just to have a little downtime to sit down and read a book, or just
Have
to
a
sit down
cup
and
of
have a cup of coffee
tea.
by your side. Yeah, you
Mm.
know, whatever it is that you need to do, you need to have a moment for
Yes.
yourself.
And also because you're under stress as a caregiver, you're gonna be like,
Mm-hmm.
"God, did I give them that already?" Everybody has those moments where you're like,
Right.
"Oh gosh, did I do that or did I not do that?"
Yeah.
If you look at
Yeah.
the organizer, you can see is that it's empty or it's
Yeah,
full.
or it's full. And I
So,
mean, even a lot of my friends have started putting their medication in pill organizers. When
yes,
you go
I
over
use
two
one.
pills a day,
Yeah,
yeah, when you go over 2 pills a day, you need an organizer.
yes, I use
Yeah,
one
it
because
makes
I
sense.
don't. I have a way to
Yeah.
take something at my blood thinners at night, and sometimes for the life of me, I could not remember if I took it or not. So I
If
got
you
a
took it, yeah,
organizer so
yeah.
that I just need to
Hmm.
look. If it's empty,
And
I can.
then, yeah,
If
yeah,
it's not
I've
empty,
taken them.
take.
Or you get up in the morning and you're looking, you're like, oh, I didn't take it. Oh, okay, I
Yeah,
must do better tonight, or take it then, you know? So it really, it really gives you freedom of knowing that the medication is given correctly. And as
yeah,
Deborah said, not taking medication is a life and death situation, right? There's a reason for it. And doctors also go off of assuming that you're taking it. So when you go to the doctor and your blood sugar is high, and they're like, oh, but we're giving you all this medication, they might decide to change it to something else, not
yeah,
realizing that you haven't been taking it correctly. You haven't been taking it every day. So that's really what's causing it. And there's no need for you to add on medication
yeah.
because, it's
And
just not taking it as
sometimes
I should.
yes,
Hmm.
exactly. So no, and that is important. There's another thing that
Right.
I want to mention briefly.
An effort to just get it off ramp.
Well, welcome. Can you mute your mic for
And
me?
down the other path
Mute your
lies
mic.
the very real risk
I can hear your TV.
American ground.
It's okay. I think I can do it for you. There we go. I
Hmm.
think I can
Yeah.
mute. Yes, there we go.
Hmm.
Thanks, Carol, and welcome. Okay, so there's another thing I want to talk about, which is called the Medication Administration Record,
Right.
MAR. I was hoping to
Hmm.
I have a picture of it, but I don't think I'm able to upload it onto this screen. MAR is a form. Let me see if I can do it very, very quickly. MAR is a form that you can use. It will keep a record for an entire month of what it
Right.
that you have used, right? In terms of medication. And I certainly recommend it where you're taking a lot of pills. It is the gold standard.
Hmm.
It's a lot as medical professionals. It is the gold standard if you want a clear paper record of the medications over time. MARs
Right.
on the front, you tick every time you use the medication, you write the name in and you tick it. And on the back, which can sometimes happen where we have refusals of medication, etc.,
Right.
it
Hmm.
can, it records that as well. So you
Hmm.
want to be, let me see if I can get one. You want to consider it if you have like a complex medication regimen or
Hmm.
anything like that. It allows you to record a lot of things, a lot of different medications very easily. And you just at a glance, you can get a look at what
Hmm.
about what the record is like. Let me see if I can open this here and see it. So I would also suggest that in terms of the, looking at the medication record, looking at using the medication administration record, so that
Mm-hmm.
you can have a more complete record of what actually has happened with the person in terms of, did they get their medications done, were they
Every week, yeah.
not taken, were they refused, were they
Mm-hmm.
and it's
And
not.
that's really good information to be able to carry back to your doctor, right? So
Yes,
they're like, what's been
as well.
happening in the last 3 months, and you can kind of show them the paper and they can scan through quickly and know, okay, why are they
Yeah.
refusing to take their high blood pressure
Because
medication? And
doctors
you can then
reach
say,
out.
yeah,
Yeah,
yeah, you
yeah,
can do,
because doctors reach out, not able to bring it up, but
yes,
we will load it
that's
into
fine.
the community for you
Members
guys,
area.
so that you can see it. I'll load the MAR up into the Caregiving community so that you can look
Mm-hmm.
at it. And as I said, it's back and front. And if you're taking, more than one thing, or if you because it also will help you as a carer in terms of, if you are not
Right.
there at the time, you can, glance at the record, which has on the front all the medications when they took them and so on, and on the back if they've refused and whatever, so that you also, as the carer, especially if you're not necessarily in the same place with the person, you can have an idea of how they are doing with the medication, particularly with dementia.
Mm-hmm.
Medication refusal can become an issue,
It's high.
and we do
Mm-hmm.
need to know about that, because sometimes we might have to switch to liquid formations, or other,
Some different things.
yeah, the pharmacist may have to, have some thoughts in terms of creativity, in terms of how you change that medicine if the person is consistently refusing. So the record of
Mm-hmm.
refusal, and not relying on people's memory, because people might not, if the person refuses once, or, you want to see if there's a trend, all of that stuff, the MAR really helps in terms of you managing. Before we go into the next thing that we need to go on to, well, no, that I think is the next thing we need to talk about really is just bed and sleep. I think we've kind of spoken about with the pressure.
Yeah, but I think you need to really talk about the waterproof mattresses, which makes such
Yeah,
a difference, especially when you're dealing with incontinence care and something
yeah.
happens and it soaks straight through. At least the mattress is protected. It's a game changer, a game changer.
And this
You
again is
know.
a really, really cheap way to, it's
Mm-hmm.
not usually expensive. As you can see, you have a zip and you zip it over the mattress, usually less
Yeah.
than by size. And it will save you, because like urine is a very difficult odor to get out of things.
Yep.
And so
Yeah.
it can save you from, having to replace your mattress, for example. And also just in terms of cleanup, like if someone wets your
Yep.
mattress or whatever, it gets really, really difficult to maintain, like, without it having a lot of odor and stuff like that.
Right.
So we
Yeah.
do want you to consider, things like that, your mattress protector. I have
Mm-hmm.
some, I think we have some stuff on bathing and so on before we
The
get
bath
it.
chairs, the bath commodes, yeah. They are, I know some very often people will say, "Oh, just put a plastic chair in the bath and they'll be fine." But the thing with the plastic chairs are there are no rubbers on the bottom. The chairs, depending on the weight of the person, the legs on the chair break. It's always a little tricky.
Yeah,
The good thing with especially like these shower chairs, they have handles on the side that the patient can use to help get themselves in and out, to push themselves up off the chair, and they're sturdy, so that you'd have no real risk of it just cracking underneath. And as you know, with plastic, the more you bathe it or the more it gets wet, the
yes,
weaker the
it's going
plastic
to
becomes, right?
deteriorate. Yes, it's going to
So these
deteriorate.
are great. And I
Mhm.
mean, the bedside commode, I have had people use the bedside commode in the shower. You know, take out the bucket and then use it in the shower. That works as well. It's, I do understand that it's expensive to buy both things, especially if you need to have both. So I get it. And it's not a bad, it's better, it's definitely better than the plastic chair in the shower. Let's just go with that. And depending on how much space you have, because the shower chairs are usually a little narrower. So it depends also on what sort of a setup you have. that it may be easy, maybe to be able to fit into your shower that you can use it. And, as you see, it also has the rails to make it very safe. The
Let me
slide before
interrupt
Deborah
you for
had,
1 minute. 1 minute. Grace, if you're still in the room, take care. You can catch this replay on YouTube, and I'll post it in the community because Grace was saying she's got to leave, which is
absolutely.
that's okay.
Yeah,
You can catch the
that's
rest of
fine.
it. We'll definitely post a replay. Another thing
Right.
about the bedside commode, Mel, which again talking about fall prevention, right? Sometimes it is better, especially if you know the person is shaky, if you know that you don't have a lit
Mm-hmm.
pathway. When I talk up in terms of dementia care, we talk about lit pathways to the bathroom,
The bathroom.
so
Yeah.
that the person can wake up in the night and see clearly, because this is a well-known cause of many, many falls
Mm-hmm.
and accidents at night. So if you know that the person is at the stage where even the lit pathways and so, or if
Not working well. Can't manage with it. Yeah.
or their mobility has really decreased, consider putting a commode beside the bed. It is
Mm-hmm.
cheaper again than a hospital admission, right?
Yeah.
And the thing that
Definitely.
I have to say quickly is that when older people fall, for us in medicine, it's always an emergency. They potentially can
Mm-hmm.
hit their head in addition to the fractures, and everybody, once they fall, we want to have a look at their skull. That is an MRI. We want to
Mm-hmm.
whether or not they're bleeding on the brain, because that can be fatal. So it's a lot of expense when you have falls, right? If you're gonna safely manage it. So if the person has transitioned to the stage where they're really not, making it to the bathroom well, and there's some potential that they're not gonna make it to the bathroom without an accident of some sort, either the urine coming down, or you having a
Mm-hmm.
cleanup issue, or them having a fall. Consider putting the bedside commode just beside the bed. You can empty it in the morning. The world is not going to end,
Yeah.
and you will save yourself a lot of admission and a lot of money. That we have to be mindful that, as I said,
Yeah.
sometimes sometimes you're trying to save in one way and it ends up costing you
In a
in
lot of the
in
ways. Mm-hmm.
another
Yeah.
thing go ahead.
I was gonna say, with the lit corridors at night, they now have these amazing lights that are dusk to dawn. And you just leave it plugged into your outlet. So, you all of a sudden have a space that's lit no matter what. Once it starts getting dark, it comes on.
Yeah.
The other thing with the bedside commode, just put in a little bit of disinfectant in it, a little water and disinfectant, so that they're not feeling as though, and no matter what happens and what they use it for in the night, it won't have an odor.
Mhm.
And that is a big thing. People always talk about the odor, but once you do that, then
And you can
you're
close the
pretty
lid.
good.
I don't know why
Yeah,
didn't
you can close the lid, of course. Yes.
close the
Yeah.
lid of it. A lot of people have the
Mm,
thing standing open, and then it's like, close the lid
mm.
until the morning, because if the person if the person, for example, has a prostate issue, they're probably gonna need to use it more than once.
No, multiple times in the night. Yeah.
Just leave it there, as you said, put a little scented disinfectant and water in it.
And you're
Close,
good to go.
close the lid.
It makes your cleanup easier as well. Significantly easier. Yeah. Yeah.
So I think
Mm,
this is the last thing. Well, right. So couple
yeah.
of other things really quickly. Reaching and grabbing tools, Mel.
Yes, especially for those people who like, if it not only for surgery, because people always think of these as a post-surgical tool, but if you have difficulty bending and you feel dizzy, or persons will say to you, if I can't get that low, and they're trying to do all strange things, put one leg wider than the other, and just get a reacher. It's easy. They're very lightweight and they're very effective. They pick up most things and saves them from trying to bend down and then not being able to get back up when they end up on the ground. All
Please,
right.
please get a reacher.
Mm-hmm.
That's the specs for the reacher are there. As I said, I'll try to convert some of this into a handout,
Right.
so that people can think. So the specs for what to look for when you have a reacher is there. I'm gonna mention a few other things. This is the bedside
That
organizing.
caddy. Mm-hmm.
You can
Love
have something
those.
like the ones here, the cloth caddy that has pockets that you can sling over the
Mm-hmm.
side of the bed and stick your phone and the patient's phone, or whatever they need, a notebook, all of that sort of stuff. You also can
Mm-hmm.
have a trolley that is bedside. A
Mm-hmm.
price, as I can say, in Jamaica has some really nice 3-level ones that they've got lovely, they're very movable and they're
Right.
lighted. So if you're a patient
Mm-hmm.
and you want to stash, like your phone and stuff, and there's not a table nearby, or reaching the table is awkward and it's giving you
All.
shoulder pain or neck pain, using
Mm-hmm.
a simple either caddy, a cloth caddy that hangs on the bed rail, or the trolleys, or if you have the wherewithal to get the trolley that rolls over the bed with, right?
Mm-hmm. Mm-hmm.
Um, any one of those things, or some of us, Caramid in Jamaica sells a lot of those, those medical tables that people eat on.
Right.
And
Yeah,
then
they
when they're
have
not
those.
eating, and then when they're not eating, they use it to store their phone and stuff like that.
Right. Rest it there. Yeah.
So you have to just be careful with. I like the caddies and the trolleys because the trip and fall risk for everyone else with the tables.
Yes.
It's the tables kind of they're a bit wide, they're a bit thick. So sometimes people,
Yeah.
if your space is a challenge and so on, you might find a caddy or one of the trolleys is an easier thing
Easier.
for
Mm-hmm.
you. The other thing that we wanted to mention, I think, is this the last slide? I think it is, yeah.
Mm-hmm.
So the other
Mm-hmm.
thing that I wanted to mention, so let me stop sharing now,
Mm-hmm.
is I wanted to talk about things like whiteboards,
Mm-hmm.
care logs, notes,
Notebooks. Yeah.
because care logs particularly can help, and you can purchase. We will soon have Caregiving will soon have a care log that you can purchase the pages, or you can purchase all the pages and use them as you need, and then you purchase it once and you reprint it. You can just print it
As
down,
many times as you need. Yeah.
right, so that it saves you, oh gosh, my log has run out. You just keep printing the pages, and you have, you can make as many notes as you want. You can, you just need to use a binder and put everything in it. But a care
Mm-hmm.
log can really help everybody to understand what is happening with the patient, everything, their bowel movements, their
Mm-hmm.
medication, their meals, how much fluid they've had,
Yeah.
sleep, or
Sleep.
anything,
Everything.
symptoms, any
Appointments.
questions, and if we need to order stuff and all of that sort of thing. So if care is shared, so some of us
Mm-hmm.
might be accustomed to seeing nurses write in a notebook. Most nurses will ask for notebooks to be purchased, and they're going to put in the vitals and whether they ate and all of that sort of stuff. Even if you are just working as care, if it's family doing shifts, or once it's more than one person involved in the care, and even if it's one person, I would really recommend as a caregiver that you keep a log, a structured log. I've listed out the stuff there that you can start with, and as I said,
Mm-hmm.
we'll soon issue, give you
Have one.
right, have one that you can purchase and print. But it is good to keep a track. You don't remember as much as you think you do, especially when you are a caregiver and you are tired and you
And
are.
under stress.
I don't remember a lot of things, so I write notes, and it is a good habit to know, because I will look back and go, oh, they did do that, or oh, I didn't realize, yeah. So you think you're gonna remember and all of that stuff, but you probably not. So consider doing that. Consider having a log, so that you're making notes every day of certain things. Even if you don't have nurses, if you're just you don't have any medical training or whatever, still keep some sort of log, a daily log, if you're caring for someone, right?
Mm-hmm.
The last thing I think we want to talk about here is the online systems. Now,
Yes.
Caregiving is an online community. I am fully aware that it is such a struggle for a lot of us to do things online. Okay, it is, for a lot of people, it's a huge barrier. I'm very, very aware of that. Right up until I transitioned to a community, I had lots of followers. And now we're building back, because a lot of people really struggle with accessing online. So online is, and I think they see it as sort of, oh, it's convenient for me, but it's not convenient for them. But
It
online
is.
allows, yeah, but it's so online first. The very first practical thing about online is it's saving everybody money, right? If I have to come face to face to teach or to treat, that is gonna cost more because it's gas,
Mm-hmm.
it's time, it's
Mm-hmm.
physical time, and all of that sort of stuff. That is gonna cost more than a solution that you access online. Always, every single time, it is going to cost you more, right? So as a caregiver, it's money saving in some ways. Like the reason why I created this community is to save everybody money. You have access to stuff without having access to me. You will have access to stuff from all of the people that we're interviewing, from Melissa and myself, from Tanya and myself, the any stuff that we have developed, and the meaningful activity stuff is in the community and so on. Because if I have to come to everyone individually to do that, most of us are gonna find that cost punishing, right? So
Prohibitive.
and the same goes for the online systems that I talk about a lot with my caregivers: bill payments, ordering
Mm-hmm.
groceries. You can
Mm-hmm.
use, do you have an app on your phone where you can put? I use Google Calendar, where you can put all your appointments and they come up automatically and say, hey, you've got this coming up at 9 o'clock, or hey, you've got this coming up at X time. And also, you can't put that there because something's already there, right? Are we
Right.
using delivery services? Are we
Mm-hmm.
using online reminders and planners and timers so that we are able to organize our tasks? Bill payments
Mm-hmm.
alone. So Jamaica, especially around payday, the lines are long,
Madness.
right? I have got a lot of caregivers who are stressed and complaining. I'm so tired, I'm so tired. But you're in the supermarket 2 times for the day. You're up and
Mm-hmm.
down. And I understand for some carers, let us be frank, it's an opportunity to get out of the
Get
house,
out.
right?
Yep.
It's an opportunity for you to get some fresh air. But consider that you
A
can just get
guilt-free opportunity. Don't forget that part. A
right, guilt free.
guilt-free
Because
opportunity.
you could just sit down and have a coffee, right? Or you can go somewhere. You have permission from me, I'm giving it to you, to go
Mm-hmm.
somewhere that isn't related to care. You can go sit down, have a cup of tea out, you can have a sandwich, you can go out and have a meal by yourself or with your friends and catch up with your support structure. You can, or not, or just by yourself, right? But
Mm-hmm.
when we are running out to pay a bill and then run out to pay another bill, do we have even a calendar? Let's say you're analog, you're not digital, meaning you don't want to use the phone apps and everything else.
Apps.
Do you
By a
have
diary.
on a calendar or in a diary when
Mm-hmm.
every bill is due? So that so that you can organize. Because let's say JPS is due, let's say the light bill is due on the 25th and National Water Commission is due on the 3rd. Can we pay both of them on the 25th so that we don't need to run out again on the 3rd? So when we use planning like that, I'm meant to talk about just the online stuff because I'm telling you that saves you a lot of time and money. If you can sit at your desk and through in Jamaica, we have Bank of Nova Scotia. Most of the banks allow you to do
Mm-hmm.
bill payments straight from your account. I'm sure it's the same in Barbados. I'm sure it's the
Yeah.
same in most
Yeah.
of the Caribbean. That you
Yeah.
can go into your bank account. So you don't have to go and look for, JPS in Jamaica has an app and you can pay the bill in the app. And you can also report out
Yeah.
within the app and you can do lots of things in the app so that you don't have to be permanently on the phone,
Calling and calling.
permanently
Yeah.
sitting out, right? But
Mm-hmm.
let's say you don't want to use your credit card at all of these different apps. You can go on your bank app, Scotiabank or whichever bank, Royal Bank, RBTT, whoever, and you can pay your bills there, sitting in your
Mm-hmm.
pajamas on your couch with a cup of coffee. You don't have to get dressed. You don't have to drive out. If you are, I shop a lot at PriceMart, but if you don't, if you shop at a less bulk retailer than PriceMart, ask your supermarkets and stuff, do you do delivery? I was very
Mm-hmm.
surprised the other day what the cost for delivery is because I had ordered a really heavy item. I ordered a treadmill and I was like, oh my goodness, I just they need to deliver this. and the cost for delivery was so low. It's not like it's a huge additional premium cost. So check with your favorite supermarket. Like we have high, low, and so on. Check with your favorite supermarket. How does that delivery thing work? Right. I absolutely hear that all of us want to, check all of our fruits ourselves and we want to pick our meat ourselves. But there are lots of items that we need: diapers, non-perishables, diapers, washing soap, dishwashing liquid, and so that we don't need to go to the supermarket for that, guys.
And they will never. The supermarket will also never send you anything that's bounced because they know you'll return it and make them come back for it.
You have
So
the
they
right
don't want to do that twice.
Yeah, you have the right
They
to
don't want you to do
return
that twice.
that. So online systems like that. I've spoken about the pharmacies with the blister packs. Some pharmacies in Jamaica have it. Our community pharmacies have it, and also I hate to keep saying Fontana. Maybe they should sponsor me, but Fontana, they have medication managers. So ask
Right.
the medication manager will take your prescription, keep it and fill it, and call you when it's time for it to be refilled.
Filled,
Right?
yeah.
So you don't have to be thinking, oh my gosh, because you also, if you have a car in Jamaica, you have to think about when are my car documents renewing. There's so many other things that are renewing: your insurance, you this, you that. Have a diary where these important dates, put them in, right? And app online, all of these things for me are in Google Calendar, so I know when my bills are due. I know when
everything.
Yeah, and because everything comes to my email, to Gmail, Google Calendar pulls all of those things that have
And
dates
puts it
and
in.
times, and it automatically puts it into the calendar. So it doesn't mean that you have to spend all day now fiddling with your phone either. If you use the right connectivity, it will just automatically pull all of the dates from your emails and place
And
it
put
in
it
your
in.
calendar, so that you eventually you have, the due dates for your bills, what meetings you have, when everybody's prescriptions are up and all of that stuff. And as I said, the bill payments, I think it's a big thing, because joining lines and waiting for long periods of time and so is burning.
Not worth it.
It contributes to your burnout and the sensation of overwhelm. You're doing so many things and all of that sort of stuff.
But also stuff like cooking as well, right? Yeah, cooking as well. Being able to get a prepared meal. So knowing that if it's a specific restaurant that has prepared meals that you like, and your care person that you're caring for likes, just having a delivery or having that option of having somebody bring food to you, as opposed to having to come home every day and be like, what are we going to eat? What are we going to eat? And that you want to be giving a certain standard of food. So, you want to have vegetables and a very healthy meal. You need to figure out
But
that's a good option.
And we have in Jamaica, we have a lot of delivery services for food as well. Certain Crepes comes to mind. Lots of ways that you can get things brought to you. A lot of the supermarkets, after you said that to me, Melissa, I went and looked, and a lot of the supermarkets do have now ready meals that are packaged and they put on a warmer. And if you want, you can call the section that makes the meals, and you can order for the week.
Right.
You
Us
can
here
just,
too.
so
we do that, and we have particular services, like people who will cook and bring food for your relatives, and it's a good, so the portion sizes are healthy. So I find a lot of the older people will say, well, I had some for lunch and then I had a little bit later for dinner, and so that the convenience of that too is that you have one person to pay. So even if you're not in the island, you're caring from away, you can book food for your family member for the week. And they send you a menu on Sunday. This is what we have. And you're like, okay, mom doesn't eat macaroni pie, so we're not having that. We're having rice and peas instead. And they will facilitate. And every day someone comes. And it's also a good wellness check, right? They know that at 10 o'clock, they're going to have the knock on the door because George is out there with lunch or whatever, And so,
no, it's true. And so, because when Melissa said it to me first, for everybody who's wondering what I was saying, when Melissa said it to me first, I was like, I don't think we have that in Jamaica, but we do. We actually do. And that can save a lot. Even if you have a living helper and so on, there's nothing wrong with 1 day a week. You
Mm-hmm.
know, you give her a break as well, or whoever is caring, and you
Yeah.
just order in a meal. You know.
Yeah. Or if, even if the person is on vacation, or, some people will get sick. So it's a good option. If
Yes.
someone is not there to provide a meal, this is how we're going to eat today.
All
You know?
right. So now
Hmm.
I think we've covered everything. We're like a half an
Yeah,
hour.
we did a good. That's
So
fine.
I'm
Yeah.
going to, which is, yeah, it is
It's
good
not
because I
bad.
did want to get in. No, and I did want to get everything in because, as I said, we do want to give you as much value as we can. As I said, I did promise to
Comprehensive.
put you,
Hmm.
yeah, and I did promise we'd put you on game about a lot of things, which I think we have done. So Mel, let's run away. Well, let's run away. Let's run through the key takeaways, right? That
Okay.
I think are from this session, and then we'll close up, right? So let's
Okay.
take them one at a time. So
All
you would
right.
start.
So firstly, yeah,
Mhm.
not every gadget is right for every person. Everything needs to be customized. And we don't expect you to know everything. So please ask for help. Call a physio, call somebody who's in that profession who has an idea that they can give you a word of guidance. Better to
Yeah.
pay for that one visit than to end up having to
Yes.
pay for the hospital visit. All
Yes.
right.
Walking
Mhm.
aids have to be prescribed properly and used correctly for them to be effective. Hate to keep saying speak to your physio, but speak to a physiotherapist about this. If you're prescribed or recommended a walking aid, even if you purchase it, it should be adjusted, as we mentioned earlier, so that it is not actually adding to the problems that the person has. A properly adjusted walking aid is a must. Mel?
Yeah. Transfer belts and supportive handling tools are very useful, but remember, if a transfer is going to be unsafe, look for help and just don't do it until there's somebody there to assist you. There's nothing worse than hurting yourself or hurting the patient, and then they lose confidence, and then every single transfer becomes more difficult.
Much more difficult. Good quality
Hmm.
continence products save time. Please, they
Yeah.
reduce leaks, they reduce repeated changes and extra work. So really pay attention to not just the cost of your continence products, but the quality. Yeah.
Yeah. Okay. Remember, incontinence pads with handles, or as we discussed, the sheet, really make repositioning easier. And they help you, just not only make it easier, but they make it more comfortable for the person who you're managing.
Yeah.
Hmm.
Incontinence pads with handles and similar repositioning aids can make bed care easier in the right situation. Or, as Mel just said, the draw sheet. But just bear in mind, when we are repositioning, we just want to not be hanging on to people's limbs and potentially causing further injury.
Hmm. Hmm. All right. Pressure care matters. So, we're not only looking for comfort, but we're looking for using them as repositioning tools to make sure that we don't end up getting pressure sores, which will then cause more problems and
Yes.
require more care and more attention. So be
Mhm.
very cognizant of making sure and checking those areas while you're in your bathing and those other
Mhm.
times. Right?
Restraints are sometimes something that we need to use, but remember that it requires caution, careful consideration. You want to preserve the dignity of the person and you want to monitor the use. So they should never be used casually or simply because the nurse wants a break, and if they know if they restrain the person, they can do what they want. That's not the appropriate use of restraints. Okay, so use them with caution and maintain the person's dignity and monitor what
Mhm.
is happening when you have applied a restraint.
Yeah. Pill organizers, pharmacy blister packs, and the MAR
Medical
make
administration.
medication. Yeah, you know, right? Make medication management clearer, safer, and much less stressful. You'll know what has been taken, what hasn't been taken,
Yeah,
and it also gives you information to be able to carry on to the doctor.
yeah,
And information is key in care.
it is. Amen. Online
Mhm.
systems and simple organizational systems. So if you can get online and save yourself time with bill payments, with purchase of groceries, etc., If you are not someone who is online, can you use logs? Can you use the medication administration record? Can you organize so that you know what's due, what is, you know, what needs to happen when, so that everything is less stressful for you? Yeah. So
Yeah.
always consider those things, either online systems or simple organization systems. And frankly, I would recommend both. And finally, I'm just going to say for the last time, everybody in Caregiver knows that this is my mantra. Good caregiving becomes easier when you build systems, right? Not just efforts. So you want to work smart, you know, as well as, you know, we all know that, you know, you care for the person you're taking care of and you're making your best effort. But we don't want you to just work hard. We really, really want you to work smart. And that happens when you're able to build systems so that it makes it easier for you. And when you're able to use the tools that take the weight off of you. Melissa, do you have any other thing that you want to add before I thank everybody and wrap up?
No, I think it was a very informative session, and I do thank you very much for inviting me to share this time with you
So pleased to
and
have
build
you
some
here.
contact.
I'm so pleased to have you here. You guys are going to see more from Melissa. She is one of, I think, the primary partner with me in Caregiving, especially in the physiotherapy aspects, which you're going to see more and more stuff that brushes on the physiotherapy aspects, exercise aspects, and really exercise prescription and things like that. So Melissa is a major partner in Caregiving. So you're going to see a lot more of her. I really hope that tonight gave everybody some practical ideas that you can really use. And I hope that it reminded you that you do not have to do everything the hard way. Okay. So the goal is not to get more gadgets for the sake of having gadgets. The goal is safer care, less strain, less confusion, and calmer days for both the caregiver and the person delivering care. Okay. So if anyone has any questions, Carl, do you have any questions for us before I bid everyone good night?
No, not tonight.
Carol is also a member of my support group. So, and she always pops up for everything that I do. Carol, thank you so much for your support.
Sure.
I love that. I love you. So everyone, please take care. We're gonna wrap it up here. So thank you so much for having a look at our third episode of the Calm Care Spotlight. And as I said, you can look for much more from both me and Melissa. And you can look for more from Calm Care Spotlight as well. So we hopefully see you in the Caregiving community. And as I said, just remember to make use of all of the tools that you have access to within the community as well, so that you're getting the most out of it. So that's it for tonight. Everybody, thank you, Melissa. Thank you so much for being here. I sometimes forget to thank Melissa because she's like my rib, like we work together. So I sometimes forget to give her appreciation. Thank you so much, Melissa, for taking the time to be here this evening. And as I said, you'll see much more from us in the Caregiving community. So everyone, take care until next time. Bye-bye.
Bye-bye.
Bye. Night.